myself Dr. Savia Khan, Associate Professor, Samrat Pratiraj Chauhan, Government College Ajmer. So dear student, today I am going to explain you the cardiac cycle. How does the heart function? Let's begin the cardiac cycle. The cardiac cycle, it begins with the joint diastole. Let me tell you that when we are studying the cardiac cycle, you should be familiar with the words diastole and the systole. Diastole means relaxation and systole means contraction. So when the cardiac cycle begins, it starts with the joint diastole. That means the atria and the ventricles, they are relaxing. All the four chambers are relaxing. Cardiac cycle is a series of contraction in the heart that pressure floods into different chamber, causing blood to flow in one direction. The activities of the heart through one complete heartbeat includes the contraction and the relaxation of both the atria and the ventricles. So, the cardiac cycle includes the systolic and diastolic activities of the atria and the ventricles. The blood volume and the pressure changes within the heart and the action of the heart valves. Now I am describing the very important step of the cardiac cycle. As I told you before that the cardiac cycle, it begins with the joint diastole. So when there is relaxation in all the chambers, the blood is flowing into the heart. Now this blood is flowing into the heart. The atria and the ventricles, they are relaxing. So now the blood has to flow down. The bicuspid and the tricuspid valves, they open. But the semilunar valves are closed. At the same time, the SA node, it is transmitting impulse. SA node transmit karega impulse ko. Due to which the impulse, it spreads up to the ventricles. When this SA node is transmitting impulse, the atria contract. Why the atria contract? Because they have to pour the blood into the ventricles. Due to the contraction of the atria, the blood now it is coming into the ventricles. जब blood ventricles में आता है then it is causing pressure in the ventricles. अब किसी चीज़ में pressure पड़ेगा तो क्या होगा? What happens? The blood flow rate is increased by 30% in the ventricles. Ventricles पे pressure पड़ा, then the ventricles they contract. When the ventricle contract, at the upper part, atria, they are relaxing. Due to this ventricular pressure, अब ventricular pressure है तो blood कहाँ जाए? Semilunar valves को खुलना ही पड़ेगा. The semilunar valves, they open and through the pulmonary artery and aorta, the blood flows. Blood flow करेगा. On the upper part, the bicuspid and tricuspid valves, they close. Why do they close? Because to prevent the backflow of the blood. कोई भी चीज़ है, it should be moving forward. So bicuspid and tricuspid valves, they close. But the semilunar valves, they are open and the blood is flowing forward. When the ventricles, they have pushed the blood. अब ventricles से उन्होंने अपना blood pulmonary artery और aorta में डाल दिया तो they have come in a relaxed stage now. So as the pressure is released, so the ventricles, they relax. And as I told you before, the atria was relaxing. So both atria and the ventricles, they are now in the condition or in the position of giant diastole. So the cycle, जहाँ से हमने cycle start की थी, कहाँ से की थी? From the joint systole, we have come back again to the joint diastole. Now, key factors. I am summarizing it. The important step of the cardiac cycle. They are the atrial diastole means what happened? Atria are relaxing. Atrial systole, atria is contracting. Ventricular diastole, ventricle is relaxing. Ventricle systole, ventricles are contracting. And the series of the event I have told, atria से blood ventricles में आएगा, it is coming slowly, tap, tap, tap. And this SA node is sending impulse, it is causing action potential which is moving in the ventricles, and from the ventricles the pressure is there, so the semilunar valves, they are opening, and the blood is passing forward, and the ventricles, they also after contraction they relax and again come in the diastole position, emptying the bloods into these semilunar valves. So the cycle is completed in this way. Now many times the heart, it produces sounds also. Heart is producing sound. Generally two sounds are produced, the lub and the dub. The lub sound, it is produced by the closing of the bicuspid and the tricuspid valves, or we can say the AV valves. But the dub sound, it is produced by the closing of the semilunar valves. Sometimes there is malfunctioning in the valves of the heart, so heart also produce abnormal heart sound that are called as murmur. So abnormal heart sounds are caused due to the malfunctioning of the valves. Then in cardiac cycle, 20% of the blood, it is going to the kidney and 15% is going to the brain. Why? The kidney uses this and it filters the toxins and they are excreted in the urine. The kidneys, they are filtering at least about 200 quarts of blood per day. In the brain, 15% of the blood is going, and if the brain supply is hindered in the brain, then the brain cells die. The coronary artery is providing 5% of the cardiac blood to the heart. Now, a very important terms, the electrocardiogram. What is electrocardiogram? It records the electrical signals of the heart. Now, name the scientist who discovered the electrocardiogram. It is Willem Ethonov, 21st May 1860 to 29 September 1927. He did the first practical of this electrocardiogram on the patient. Now, what is electrocardiograph and what is electrocardiogram? The electrocardiograph is an instrument that registers graphical movements of the heart. Graph, it is registering the graphical movements. And electrocardiogram, by this the heart rate is used to predict and prevent the heart disease. Means it is used in clinical testing. Now this is the picture of the electrocardiogram and we see it by the electroscope. Now students, as we are always doing, I used to ask a question in the hand and you have to reply the answer. Where you are going to reply? In the comment box. So how much time does the cardiac cycle take to complete? Or in how much time is taken by the cardiac cycle to complete itself? Then the answer you are going to reply in the comment box. So hope you have understood this. This was a very technical session and difficult session. I think you have noted everything. If you have any difficulty, then you can ask me in the group. You see the live webinars and reply in the comment box till we meet for the second class. Thank you.